In the United States, the late 60s and early 70s was a time of flower power and protests, a time of revolution and transformation. Medicare and Medicaid were new programs, and baby boomers started breaking tradition, thinking differently, and questioning the status quo. In 1971, an amazing group of pioneers led by Dr. William G. and Marie Louise Anzac took what was a simple idea of a nursing home in Chinatown and turned it into a healthcare revolution.
I'd never worked with the elderly before, so I decided to go and look at nursing homes, and I didn't particularly like them, and it's not my style. It is the time when people started to think about elderly. San Francisco had an awakening that population was aging and that something needed to be done. I guess we hit it at the right time.
In the spirit of these revolutionary times, Marie Louise realized they needed something different.
First, we needed to start a day health center where people could come in during the day. We got the day health center started on Broadway in an old burned out bar. Burned out was like terrible, it looked awful. So then finally we opened that center.
They obtained funds to remodel the center and train healthcare workers. They also put together one comprehensive system of care with an interdisciplinary team.
We had by then a small team of social workers and a nurse and a doctor who had just graduated from medical school. He was almost a volunteer.
The interdisciplinary team that emerged included nursing, social workers, doctors, dietitians, therapists, and even transportation to pick up participants for appointments and to take them to the daycare center.
The role of transportation and the drivers is something that frankly is near and dear to my heart. They're a wealth of information. There are eyes and ears in that home environment. I just think they're phenomenal.
In 1973, the nation's first adult daycare center in San Francisco opens. In honor of the rich culture in their location in Chinatown, they decide to name their newfound organization Onlock, Cantonese for Happy Home. Over the years, Onlock continued to advance and expand, establishing an innovative model of care and financing centered around the needs of their participants. This model will come to be known as the Program of All-Inclusive Care for the Elderly, or PACE. They received support from the Department of Health and Human Services and the Robert Wood Johnson Foundation. PACE also enjoyed significant support from the John A. Hartford Foundation, which has been a constant partner in its expansion throughout the country. Once PACE proved to be a successful model of care, Congress was moved to act.
It passed into federal law, and so that's the reason now we have a Medicare law that has been changed as a result of this program.
It really is about connecting with that patient and family. It frames everything differently, from how the staff interact and the fact that this is a long-term mutual relationship. And to me, that's what sets PACE apart.
As Onlock sees the success of PACE, Marie Louise Anzac offers her blessing.
She says, you know, you guys are just adolescents, but I really think it's safe for you now to go forth and replicate. We've taught you everything we can teach you to do, and now it's time for Onlock to hand over to the first generation of PACE programs that passion and vision and mission to spread the word of PACE.
As PACE took off, more and more people noticed its advantages and adapted it to fit their communities.
As I became involved in the Area Agency on Aging, I realized that there was a huge gap in services. People were going straight from the hospital setting to the nursing home. So I started looking for an alternative. The decision was very easy. Once the program was in place, there was no other choice for me. I was going with the new program. When I found out that Onlock Senior Health Services meant happy, peaceful abode, it was so appropriate, it was so fitting. Bien vivir means the good life, living well, and in fact, it was a manifestation of what we were allowing our participants to experience.
As PACE grew, so did the need for an association to help federal, state, and local government understand what PACE is all about.
PACE doesn't fit neatly in a box. It truly is a hybrid of a provider providing health care and an insurer. And because we don't fit neatly in that box, I think there's a need for engagement at the regulatory level, certainly at the federal level, but also at the state. It was one of the reasons we needed to form the association. The National PACE Association has really been the catalyst around engagement.
As the association celebrates its 20th anniversary, PACE has made incredible strides, expanding to over 100 programs in more than 30 states across the country, bringing sorely needed health care and supportive services to the elderly, helping them and their families.
We think that care should be delivered in neighborhoods so that there is a personal care plan for every patient that could literally be adjusted every morning. There is somebody for the caretaker to call. There is somebody for the home health aide to speak to. We feel really good about the way we did it.
This program is amazing because they come, they pick him up, and he has activities and things to do all day long. If I had to go to a doctor or do his appointments all throughout the week and refill the prescriptions, I would be spending many, many man-hours doing that. So having the ability to have it all in one building is fantastic.
And today, the PACE program model has proven effective not only in urban settings, but also in the rural community.
I think the PACE model calls for innovation whether you're in a rural site or an urban site. That's what PACE is all about, innovation.
New PACE leaders are innovating unique ways to use the model in their own communities.
Something that still makes PACE special and differentiates PACE from, say, a health plan is the personalized nature of this program. By its very design, this program is about taking care of individual people. I think what has made PACE successful and what allows Riverside, as well as all the PACE programs around the country, to be successful in so many different areas, serving so many different populations with such a relatively small model, is its ability to adapt to the local community. Some people say that one of the things that is not attractive about the PACE model is it's not a franchise model. Each PACE center and each PACE team truly is unique, and it truly does take on the character of the community in which it serves. And to me, though, that's not a liability about PACE, that's what makes PACE special.
Many different types of organizations make the decision to develop PACE programs. Mission-driven organizations, like Trinity Health, can adapt PACE to bring the best quality of life to their participants.
CHE, Trinity Health, was formed back in May 2013, and as we came together, a new mission and vision for the two organizations came together, which is to be a transforming, healing presence within the communities that we serve. PACE as a service focuses on one of our major core values, which is care for the poor and vulnerable. And we have made significant investments in providing PACE in many of our communities.
40 years ago, there were very few number of options in the community that allowed the elderly to remain living at home when they become frail and needed support. Recognizing that, a group of innovative healthcare pioneers came together at the time to develop PACE as we know it today. PACE continues to attract the best and brightest healthcare leaders in this country who are interested in finding and improving upon ways to keep the elderly in their community, where they can age with dignity and respect in their homes. Today, these leaders operate over 100 PACE programs throughout the country. I believe the best days of PACE lie ahead.
Just as innovation led to the creation of PACE, today innovation is allowing PACE programs to serve people of all races and ethnic backgrounds in cities and towns that span the continuum of communities from urban to rural.
I'm more capable of doing things, and I have met so many people that I have fallen in love with. Everybody is so sweet, and the people that are here are very, very, very good people, very educated and very good in what they do, and that means a lot to me.
PACE focuses on care that improves each participant's quality of life, supports family caregivers, and is able to minimize the use of hospitals, emergency rooms, and nursing homes.
The model is just unique. It serves the entire social, medical needs of the individual. It is population health. It is person-centered. I can't think of another model that would meet the needs of the participants any better than a PACE program.
Because of the PACE model of care, elderly people and their families across the country are able to live happier and more fulfilled lives.
I think what we're able to do is give them hope that they will have a life of dignity.
For me, it's not a job. It's a passion. It's a calling. And I think we'll continue to evolve and grow.
We've survived for 4 decades and will continue to survive. It's a bright future.
As the PACE community celebrates its legacy of innovation, it is important to strive to expand the number of people served and to maximize the quality of each life touched by the PACE community.
Graphic on screen reads, "Special thanks to OnLock Incorporated, not only for PACE, but also for sharing archival video. To the John A. Hartford Foundation for their several decades of continued support. To Emmanuel Pathways for supplying additional footage. Graphic transitions to PACE logo with text that reads, National PACE Association, celebrating 20 years of care, 1994 to 2014. Over 100 programs and growing."